Hello, and welcome to our presentation on preparing for a sanitary survey. My name is Colt Smith. I'm an environmental scientist with the Utah Division of Drinking Water. This is a short presentation to help water systems who are expecting an upcoming sanitary survey to be prepared for the survey and just hopefully have it go as smoothly as possible. If you have any questions, please reach out to me or to your surveyor directly. Thank you. Couple of things and a quick overview of this presentation. It's not going to cover everything that is going to be inspected on a survey. It's an extremely high level view, mostly designed to kind of give you the basics and give you an idea of what will be looked at. The methodology we used is I pulled out and queried every facility type and the most common deficiencies that are associated with those facilities to kind of give you an idea of what to expect and what we look for. Surveys are conducted by Utah Division of Drinking Water staff, Utah Department of Environmental Quality District engineers, and local health departments. If you have more questions and want to know exactly what's going to be looked at, refer to the questions that were sent to you by your surveyor for that complete list of inspection points, and it will have out exactly what they're going to be looking for and the standards that they're going to be making sure are being followed by your water system. Sanitary surveys are required every 3 years for all water system types, regardless of classification or rating. What exactly is a sanitary survey? Well, the Safe Drinking Water Act requires an on-site inspection and review of 8 specific elements for every public water system to ensure the water system is protecting public health. We're going to look at sources, treatment, distribution, storage, pumping facilities, monitoring and reporting practices, maintenance and operation practices, and then operator certification during your survey. Utah has a specific rule called the Improvement Priority System Rule, or the IPS rule. It's commonly kind of nicknamed the golf rule because points are assessed to a water system for things such as monitoring violations, physical facility deficiencies, and treatment technique violations. The more points a water system has, the more likely it is to become a target for enforcement. Points are added during a survey, and if it's a minor deficiency or a low risk to public health or a low point item, those points are effective immediately, while significant deficiencies or items that are classified as immediate risk to public health have 120 days to correct before the points are active. And that's because significant deficiencies are required to be corrected. If they are not, then violations are issued and enforcement is almost imminent for a water system, regardless of the point threshold that they're at. Depending on the type of water system you have, community, which would be most common sort of residential communities where people live, you have up to 150 points. Non-transient, non-community water systems, which would be more like a workplace where someone may be there every day for more than 6 months out of the year, but they're a rotating population or they don't live there. They're not there full time, has up to 120 points. And transient non-community systems, or sort of the fastest populations, people who come and go, think of campgrounds, restaurants, etc., have a 100-point threshold. Some things you need to know to be prepared. You may only have 2 weeks to prepare for your survey. That's the minimum time that surveyors are required to give, and you may not have much longer than that to get ready for it. One of the big things to kind of have prepared for you is cross-connection control program documentation. There's an increased focus on making sure the cross-connection control program is being implemented, and having documentation of those activities is essential. If you don't know where that is, you can start working now to have some of that prepared and work with Gary Rager at the Utah Division of Drinking Water to make sure that you have the documentation needed. Keys. This is a big one. I can't tell you how many surveys I've gone on where we show up and water operators spend a significant amount of time looking for keys to access their facilities. As a surveyor, if you don't know how to get into your facility or where the keys are because you haven't been there enough, I know that it hasn't been checked regularly, and I'm kind of on heightened alert. And it's just sort of a waste of yours and my time and your surveyor's time to not have those ready to go. Perform a walkthrough of your system before the survey. A lot of the deficiencies that you're going to see here are easy to spot and fix before the inspection. Do a walkthrough, check for those things, especially some of these highlighted ones that are going to pop up here later. Help prepare your surveyor for the survey. Let them know if there's a significant hike to get to the sources, or if they're might be an ATV needed to access facilities. It's helpful to know the type of shoes that are useful. I've been on some surveys where my cowboy boots are perfect, and other surveys where trail runners would have been maybe better, a little more grippy. Assume that your surveyor is going to show up in a small two-wheel drive sedan. We're not necessarily outfitted with four-wheel drive and off-roading capability, and if your surveyor cannot get to the facility, it becomes incumbent upon you to provide documentation, and we'll talk a little bit about that later when we discuss the Division of Drinking Water's no-go policy. Review your inventory and IPS report and send any corrections to the surveyor before you get there. The surveyor should provide you with a copy of those questions, like I said earlier, and you should look at those and make sure that all the inventory on it is accurate, that it's showing that the facilities that are active, and that if you have facilities that are inactive, they are listed as inactive. Check and see if there's IPS items that can be corrected before they get there, that might be you've already submitted or have already done the fixes for and can submit documentation. Have program information available. This is stuff that a lot of systems don't necessarily think about for their survey, but know what your current population is, your service connection, and again, the activity status of those facilities, and have the operator certification information available to your surveyor. The Division of Drinking Water has a survey no-go policy. If a surveyor determines that accessing a facility poses a safety risk to them, they have the option to opt out of inspecting the facility. The water system is then responsible to submit photographic evidence to resolve assessed deficiencies and determine if the facility meets standards to protect public health. Some examples, and this isn't all of them, are unsecured ladders or no ladders to access the roof of a tank. Confined spaces are a big no-go for us. Weather, if they get up there and it's lightning on the day of your survey and in an exposed area, the surveyor can opt out of that. Snakes are a big one, or anything that the surveyor can justify as to why it does not look safe to them to meet that facility. What will happen is all of the deficiencies are assessed against that facility that cannot be verified, and then the system has to submit photographic evidence later to the surveyor to provide that it's there and resolve those deficiencies. All right, let's talk about facilities. Let's talk about some of the most common well deficiencies. These deficiencies listed above account for approximately 63% of all deficiencies assessed to wells during sanitary surveys. And a lot of them are easy to fix. If the end of the pump to waste line lacks a number 4 screen, well to pump waste not downturn, wellhead or well house not protected from flooding, that might be a little trickier to correct quickly. End of air release vacuum valve lacks the number 14 screen, and well casing terminates less than 12 inches above the floor or less than 18 inches above ground surface. Some of those are trickier to fix, but some of those screen ones are pretty simple to have on hand and to be able to make sure that you're not going to get dinged for that during the survey. Springs. The most common spring deficiencies are deep-rooted vegetation in the spring collection area. That's going to be trees right next to the spring. Roots in the spring collection pipes. Spring box lid lacking a gasket. That's a pretty easy one to have fixed there. Unapproved source and service. That's a little trickier. That's where the source has been either deemed required to disinfect or lacks an operating permit. But that's one that if you don't know if you have, you should be able to work with your surveyor beforehand to make sure and see if there's one on file. Spring box overflow or drain lacks free fall of 12 to 24 inches. This one is typically able to be fixed with some excavation and some digging out. I've had to assess that one a couple of times, but it's one that you could probably fix by doing a quick walkthrough. Spring box overflow lacks number 4 screen. Spring box impermeable liner inadequate or not intact. That is a trickier one. It's one that's assessed less so now, but it's sort of if the spring box is not able to be verified. That's one that's being corrected a little bit more. And then spring box lid, not a shoebox style, and that's that 2-inch lip on there. And that's just going to help you kind of know what we're looking for in the most common one. Those account for 73% of total spring deficiencies assessed during a sanitary survey. Storage tanks, it's a whopping 90% of all storage tank deficiencies are these ones right here. And most of them are things like lacking a functioning gasket. Again, overflow, a lack of clearance, a storage tank lid not shoebox style or not being able to meet that standard, end of storage tank overflow pipe lacking a number 4 screen, another screen issue, clearance, screens, storage facility vent not downturned at least 2 inches before any opening, storage tank subject to contamination due to unsealed openings on the tank roof or sidewalls. That's a big one. If we see that, that's one that you're probably not going to be able to fix in 2 weeks, but it's a good one to be walking around and be aware of before we get there. Storage tank access opening lacks a lock. That's an easy one to fix. And then storage tank lacking an overflow. The most common pump station deficiencies is inline booster pump station lacks redundancy to meet peak demand with one pump out of service. That is really applicable only if the pump is being used to maintain pressure throughout the system and not to pump up to a tank. That's one that has been sort of assessed erroneously in the past, but it's a good one to kind of have awareness of. The pump station has a cross connection or is subject to contamination. Again, unapproved facilities and service, that's a big one if there's a pump station that we discover because we come out there and it's not on your inventory. Let us know beforehand and be like, hey, I have a pump that's not showing up on my inventory when you send us out. And we can start researching that and see if there's some story behind it or if or start working on the permitting process for it. Pump station or hydromatic tank lacks piping, lacks number 14 screen. Again, that's a big one. Contamination and 6 inches above the floor, and pump station or hydromatic tank air relief valve not downturned. 98% of deficiencies associated with pumps come from those. For distribution, we're going to be looking at mostly, obviously, we're not going to be digging up your distribution system to look at it. So we're going to be looking at these vents is going to be what we're going to be looking at as we go through. Air relief valve lacking number 14 screen, air relief valve pipe not downturn, cross connections existing in a water system. If they're not able to identify that you have a valid cross connection program, or if we can identify a cross connection as we're out there doing a survey, that's going to result in that type of deficiency. This is kind of a tricky one, but if the system lacks more than 20% of required storage capacity, that's a big one. And that calculation is done by your surveyor based on numbers that are provided to him by you. We associate it with the distribution system because it's more of a whole water system deficiency versus just a storage tank deficiency. And then for community systems, without naturally flowing sources lacking backup power for at least one source, that's another one that's sort of assessed to the distribution because it's one that's going to impact the entire water system, and having the ability to have backup power supplied to it if you have a well. And then a community system serving 100 or more service connections lacking a redundant source. That's not going to be one that you're going to be able to fix within that 2-week time frame, but it's one to kind of be aware of is where is your backup water. This accounts for approximately 42% of all distribution system deficiencies that are associated with the actual facility. There's some that we associate to the facility but are more administrative because they have to be tied to a facility, and the distribution system is what we use to represent all water system facilities when there's that there, because all systems have one. For treatment, this is mostly just looking at chlorination treatment plants. Surface water treatment plants have a whole other sort of set of surveying responsibilities and violations or deficiencies associated with it. And I speciated this down just to the simplest chlorination facilities. If you're a surface water treatment plant, you can work with your surveyor directly to have a better idea of what that's going to look like. But having a 150-pound facility and don't have immediate access to a NIOSH respirator, hypochlorite facility with means of an emergency eye wash station, feed pump starts without well or service pump running and water flowing in the pipe, lacks backup power supply for required disinfection. If you're a facility that is under a required to disinfect letter order from the director, you are required to have backup power for that. Chlorine vent line not discharged outside above grade or lacks that number 14 screen. No means to measure flow rate of treated water. That's a big one. Be able to describe to your surveyor how you are measuring the flow rate of the water treated. The chlorine vent line not discharged outside above grade or lacks that number 14. Sorry, that one's on there twice. And then adding chemicals that do not meet NSAI NSF 60 standard requirement. That is, if you are adding something that is not NSF certified chlorine to your distribution or to your treatment plant, things like store brand bleach, Clorox bleach that do not meet that NSF standard 60. Those account for about 47% of treatment deficiencies, and that's probably a little inconsistent because of the lower, because there are deficiencies associated with surface water treatment that would be a little bit different. Okay, administrative deficiencies. This is where we're looking at things like the operator certification, which is the number one for all of that. And then cross connection makes up a huge percentage of deficiencies associated with water systems. Have those 5 elements, the operator training on hand. If you have if you're a community system, if you have, or non-transient system, and you have that administrator requirement, written records of cross connection control activities, authority statements, ongoing enforcement and implementation, and then annual public awareness, have all of that ready for your surveyor. Those are the high level, the biggest issues we're going to have and the biggest issues we run into. After we complete your survey, what's going to happen? Well, you should get your report within 30 days of the final day of inspection. That is our requirement to have it back to you. I pride myself on trying to get mine out to you as quickly as possible. Review that report and any of the deficiencies that were added to your water system in that report. Submit photos of the corrections to ddwips@utah.gov or work directly with your surveyor to get the deficiencies resolved. When you submit those photos, include the system and facility names and the system and facility identification numbers and the deficiency that's being corrected. So if you come out and there's not a screen on there, take a picture of the screen, send it to that and say, this is my water system number. This is well number 1, WS001, and I'm correcting the screen deficiency that was assessed. Remember, you have 120 days to correct a significant deficiency before those IPS points are active, and a violation will be issued if you do not meet that deadline. And then it becomes reported to the feds, and it becomes a candidate for enforcement. If you need more than those 120 days, and some of those deficiencies are definitely going to require more than 120 days to complete, go to requestcap.utah.gov and you can request a corrective action plan to get an extension for that correction. That is always up to the Division of Drinking Water's discretion if they issue that cap or not, but please do so and make sure you get that in before that 120 days expires. If you have questions, the Utah Division of Drinking Water, you can reach out to the division directly at 801-536-4200. Drinkingwater.utah.gov is our main website, and then waterlink.utah.gov is a website where you can see all the data we have on your water system, including inventory, IPS scores, bacteriological histories, and in your current IPS score and any deficient violations that are being assessed, as well as your monitoring schedule. Thank you for watching, and good luck on your survey, and reach out with questions.